Okay. What is your name?
Pam Hopman.
And tell me a little bit about yourself, Pam. Where are you from?
I'm from St. Louis, and I've had TMJ problems for over 3 years now. And
What were your symptoms?
I had a lot of neck pain and back pain, but mostly I had trouble chewing. Initially, I had clicking and popping in my jaw joint, and was having a very difficult time eating because chewing was painful. So I saw a number of practitioners in the St. Louis area.
How many did you see?
I saw 3.
And over how long a period of time would it be?
3 over, I guess, almost a 3-year, a 2.5-year period.
Okay.
Right.
And then you came to Kansas City to see us.
Right. I came here because I wasn't, the practitioners I saw in St. Louis only took me so far, and I really wasn't getting any better.
Okay. And you're doing a little better now?
I'm doing a lot better, yes, yes. My pain is very, very little, hardly any pain anymore. And you know, I think I'm progressing well.
Okay. And you're at what stage are you in now?
I'm wearing, I have braces on my upper teeth and fixed orthotic on my lower teeth.
Okay.
And been in braces a little over a year.
Okay. So would you please read that statement that you have in your hands? And
Sure. This is a AADR TMD policy statement. What it says, and the thing that kind of stands out to me is one of the things it says on here is studies of the natural history of many TMDs suggest that they tend to improve or resolve over time, and that just has not been the case at all with me. I just kept getting worse and worse, and even with medications and even with seeing 3 different practitioners, my pain wasn't getting better, my chewing wasn't getting better, and I was really very desperate for help because I didn't want to live that way the rest of my life in pain.
so what would you tell these folks that actually wrote the statement basically saying, really don't do anything, it'll get better on its own?
Well, I would very strongly disagree because that was not my experience at all, because I tried that and it didn't work. I tried, even with the help of some other people, it didn't get better, so it obviously wasn't going to get better on its own, and you find yourself in a very desperate situation, and you really don't, you know, your quality of life is terrible because you really can't do anything because you're in pain all the time. So I think to say that it will get better on its own is just ridiculous. It just has not been
If you
my
could
experience.
address them, if you were talking to these folks, what would you tell them?
I would say that, show me someone who has gotten better on their own, because that has not been my experience at all. And I know people who have gone through TMJ problems, and they've always had to seek out professional help, and always usually had to have extensive treatment and not just deal with it on their own. So I think it's ridiculous to say somebody will get better on their own.
Thank you so much.
Okay.